All right, we ready?
Ready.
Gentlemen, how are we doing? Yes, sir. Yes, sir. So I'm joined here by Dr. Jay Briggs, Dr. Matthew Vincler. I've been excited to actually do this talk with you guys for a long time now. You know, we've all been practicing, I don't know, a combined total of way too long, a long time. And, you know, what gets me up every day and excited every day is just seeing how chiropractic and how this whole idea of natural health has absolutely just blossomed in the last 5, 10, 15 years. Just it's changed so much, and it's gotten to the point where I think people now are like coming into our office and literally saying something to the extent of, I'm ready for something new. I'm tired of being told the same thing, to take the same medication for my problems and watch things get worse. So I think there's no better time to be alive in the natural healthcare field. I think that people are starting to wake up to the fact that our bodies are beautifully made to heal. I want to start it with this as we talk just about what gets us excited about doing this. I was talking to the CEO of a healthcare corporation who he runs one out of North Carolina. It was at a corrective conference, and he was there because they were actually looking at adding some of the things that we're doing into their hospital system. And I was kind of shocked to see, you know, a CEO of a major healthcare corporation there. And I said, well, why are you guys doing this? Like, you guys have a monopoly on healthcare. And you know, it seems like you're successful and you guys have these massive hospitals going up everywhere. And he goes, that's true. The problem is he goes, we don't really have, and we all agree with this. He goes, we don't have a healthcare system. What you guys are doing is fundamentally different than what we do. In that when someone comes into our clinic, our place, we're trying to save their life in a crisis, and we're good at doing that. But when it comes to building health, that's not what we do. Over time, as people live their lifestyle, they start to have their health just decline. It gets worse and worse and worse. He goes, we don't have things that actually build people's health. He goes, we save lives in crisis care, and then we apply medicine to try to build health in someone, and that doesn't work. He's like, so you guys have these tools in your belt: nutrition, corrective chiropractic care, postural correction, helping the nervous system function better, minimizing toxins, educating people, that actually builds their health up. And so what he was talking about is something that I've read a lot in research, is that, you know, we want to work now on increasing our healthy lifespan, not just how long our heart beats for. Because all too often now in the world that we live in, you see people taking more and more medications. Maybe they're living to 70, 75, 80. But if you ask me, with some of the people that we take care of and some people who I see who are sick, I would barely count that as living, right? They have a heartbeat, they have a pulse, but they are medicated to the point that they can just barely make it through their day. And they're not living life on their own terms. So what gets me super excited about getting to be in this field and taking care of people is that we get to help people live a healthier life, a better life, a more meaningful life where they can do the things that they love long term.
One of my close friends is a GP in Florida.
Okay.
And she can only spend about 11 minutes with each patient, or else that day is not a good day for the
like washed out
economics part of the business. So I don't think that even the 50 years plus that I've been alive, I remember my mom never was taught lifestyle changes. Mm-hmm. No one told her how to not only get healthy, but stay that way. And my GP, my friend who's a GP, is ultimately not doing that either.
Yeah.
And it's been this long. So I try to do everything I can to stay out of that system.
Yeah. Yeah.
Is that set up for failure? They, if you look at the track record, it was first that evil spirits caused disease.
Yes.
And then it was your blood was bad, so we would lancet you.
Yeah.
And then it was germs. Now it's genes. Who knows what the next thing is?
Right.
So I'm running away from that.
And the funny thing, if I can interject there for a second, is like all the time as we're going through that, there are these other voices that are saying, you know, for example, when Louis Pasteur was saying, you know, hey, it's the germ, you had these other voices saying, yeah, but if you put two people in the same room and only one gets sick, can someone answer this question for me? Why is it that? What about the health of the host? You know what I mean? Antoine Beauchamp. So what about the health of the host? And they just disregard that. That doesn't get written into the history books because it wasn't the prevailing theory at the time. And they squashed down those people who tried to say that, hey, listen, your body has this amazing capacity or capability to heal.
That's one of my all-time favorite things about chiropractic is when you talk about medicine and kind of how they view things. They're always looking for a new drug. They're always looking for a new surgery. Technology in their field seemingly it gets better and better, so they're always looking for new treatments. Chiropractic 100 years ago was very similar or the same as it is today, and 100 years from now it will be the same. So the art and science and practice of chiropractic is just timeless, and it will very likely continue to be the same forever. Its utilities will always be able to be used throughout time.
Yeah. So because the philosophy is a body heals better when there's no interference, right? So some of the art may have had to evolve. I mean, we didn't have cell phones in 1908. I think now, unfortunately, although we have more technology, more resources, more healthcare access available everywhere, our health is actually worse than before. We went from a culture moving 12 hours a day to now we sit 12 hours a day. The average person sits on their cell phone 5.5 hours every day. So it's like with better technology, better resources, we're watching, it's 2023, 7 out of the last 10 years, the life expectancy in the US has gone down. It's ridiculous. It's the first time in modern history that we've ever seen that happen where we're smarter, but are we when it comes to our health? It's crazy.
Yeah, when I first learned about chiropractic, it was from a childhood friend who was in chiropractic school. This was 1990 or so, and I had never known what a chiropractor did. And when I first learned that the first adjustment is documented to have occurred in 1895, I said, why did I never even know what a chiropractor did? How can that be possible?
Yeah.
So that's one of the things we tell our patients is like one person at a time. We're helping just to expose people that there is a different way to live your life, a way better way where you're empowered, and being proactive rather than just reactionary is far more successful that way.
Yeah.
And the recent 3 or 4 years has exposed how messaging is given to us or held back from us. And the core chiropractic message is simply not something that's on the forefront of legacy media, so it just never reaches people.
It's funny. It's like you see research come out now. In the last 20 years, we've had more access to people actually doing studies on natural-based healthcare. And there was a study that came out in 2007 that was on people who living the chiropractic lifestyle. So one of the biggest studies that came out in chiropractic. The chiropractic lifestyle is not just getting adjusted. It's living through the mindset that a body heals better with no interference. So what causes interference? Well, does spinal subluxation cause interference? Absolutely. Does bad posture cause interference? Absolutely. Does nutritional stress from eating terrible foods that are made in a lab that are designed to last longer and cost cheaper, does that cause interference to healing? Absolutely. Does a lack of exercise cause interference? Yes. Does toxicity? Yes. So a chiropractic lifestyle is understanding that we live better unencumbered, right? So they did a study in 2007. They looked at a ton of people and they said, let's just track these people. They're well educated on taking care of their spine and posture and getting adjusted and staying ahead of problems. And in the same breath, we're also helping them through understanding proper nutrition, how to minimize toxicity, how to live their life in alignment with the necessary requirements for vitality. And they looked at these people over a 5-year study and they found that, shockingly enough, they were healthier. They took 85% less medications. I'm sure that some people are not happy to hear that, but yes, if you live a healthier lifestyle, you're going to take less medications. Honestly, the stats on their healthcare cost savings was ridiculous. They spent 69% less on out-of-pocket healthcare costs. So wouldn't you know, people who are healthier actually spend less.
I know this study. What's the numbers behind the medications?
Yes.
So that group takes compared to the average person.
Yeah, it's 85% less. And they're hospitalized. They're hospitalized for emergencies, get this 59% less of the time. So we see the studies that show that people who are better aligned, who have better neurological control of their bodies, they have better blood pressure, better cardiovascular output, better VO2 max. They have better ability for their heart to speed up and slow down. And so obviously that correlates to better overall function. You have to invest in your health though. So what they talked about in the study was that, listen, you have to spend some money on your health. You're going to spend it now on taking care of your spine, taking care of your nutrition, exercising, getting a trainer, carving out solid yellow lines in your life to do the things. Like there's a time investment, there's a cost investment to working on your health. I never said it was easy, but by spending some now and investing some now, that pays absolute dividends in the future. And we can back it up so many ways to the weekend.
So you said solid yellow lines. I know that's from a book.
Oh, the name of the book. I mean, it's been within the Max Living culture for a long time. I don't know exactly what book it came out in, but it's this concept that in your life, like you can imagine a jar where you have rocks, pebbles, and sand. And if you try to put the sand in first, the little rocks in second, and the big rocks in last, the jar will overfill. Whereas if you put the large rocks in first, the small pebbles in second, and the sand in last, you still have time at the end of the day for a beer. A professor pours a beer into it, and you can see it all fill up just perfectly. You have to make the main priorities the main priorities. So what that means is in your life, you have to schedule out time for yourself first. It's impossible to pour out of an empty cup. So if I'm not healthy, the concept is I cannot properly support my family and raise my children to the best of their capabilities because they look for me to help them. If I'm sick, if I'm laying in bed or in a hospital bed, I cannot serve humanity to my fullest capabilities. So we have to fill ourselves up first. So Solid Yellow Line says, I'm carving out times in my week for the things that build health and vitality, for getting adjusted, for exercising, for meal prepping, for mindfulness time, for my spiritual progression. All of those things have to be carved out. And then everything else in my life gets to filter around those. All too often, we wake up late, we're on the go all day, we're serving someone else first, we're taking care of our family first, which I'm not opposed to taking care of my family, but I can't do that unless I'm full myself. So Solid Yellow Line says exactly that. You got to carve out time for you.
I was in my 20s before I even was exposed to chiropractic, but Dr. J, you received your first adjustment within minutes.
Yeah, I think you were negative. He probably adjusted you when you were still in your mom's
womb,
stomach.
right out of the womb. And that's funny that you say that. I was just talking to a patient recently, and a lot of patients are interested kind of in my story since I was adjusted at such an early age. I'm going to get it adjusted my whole life. And the short story that I was trying to tell someone, or the short point that I was trying to tell someone is, I can't live without adjustments now. I've been so blessed. I guess I've been so spoiled with adjustments that to a normal person that maybe doesn't know much about chiropractic, these little aches and pains or these little things that they deal with on a day-to-day basis, just kind of thinking that's a part of life. Sometimes you just don't feel well. I am very sensitive to those things now because I know that there's an adjustment 10 minutes away, an hour away, a day away that I know that will help me through that. So I've just been very spoiled with that. I don't deal with little aches or pains. I don't deal with little problems in my life, waking up, not having as much energy as I should. I know that somewhere I am subluxated in some way with whatever I've done. And I'm one adjustment away from feeling better. So it's kind of my way to kind of preach to people that it's not always about how you feel.
The definition of health is that, right? The definition of health is not how you feel, not an absence of symptoms. Really, the best way you define health is a series of actions that build vitality, right? So symptoms come, symptoms go. But if you're doing the right things on a daily basis, you will be building health over time. That's what we consistently understand, right? Waiting to feel heart disease takes what, 18, 20 years? Yeah. How long is cancer developing in your body before you feel it on average?
Yep.
Right?
So children are so honest and candid with each other. You probably have a story when you were a child at school, just talking to your classmates.
You know, there's a video in the office that loops over and over again about my chiropractic story, so a lot of the patients have heard it. But when I went to school, I was just very confused all the time. When you grow up under chiropractic, you just live life a little differently. When you're under the chiropractic principle, you just live life differently than, especially back then, than the other kids did at school. So when I would go to school, the other kids would talk about, you know, I was sick over the weekend. My parents took me to the doctor. I took medicine, and I was like, what is this doctor? And what is this medicine thing that you speak of? Because
what is he doing to you?
When we were sick, my parents, you got adjusted, you rested, you stayed hydrated. My parents might give you a few supplements, vitamin C, vitamin D, magnesium, zinc. Just the protocol in our house was just different than most kids at school. So I was constantly coming back home saying, you know, why are the kids talking about, you know, getting medicines and things like that? And my dad's short answer was, to me as a little kid, was, you don't need them.
Yeah.
Your body has the ability to heal itself. And he goes, you've been sick a dozen or more times in your life. How'd you turn out? I'm like, I seem to be fine now.
Yeah.
Now that I've gotten older, I now know a ton of people, having been through chiropractic school, meeting you guys. You meet people in the chiropractic practice. You just meet so many other people that live this principle. So now you know, you just meet so many people that also turned out well. It's like, I have cousins and friends now. I don't want to get too controversial, but when it comes to vaccines, I now know a lot of people that have never been vaccinated, and everyone that I know so far, I know this is anecdotal, but they've all turned out well, and they're all the healthiest people that I know personally.
Yeah. Yeah. Well, it's like we live this life and like, it's like we're on this trajectory, and then here's where like the two paradigms and philosophies of health differ, right? You have vitalism and then you have reductionism. So it's like this reductionist model of healthcare has been around for 150 years, which says if you're sick, something must be broken, right? So what we don't do is we don't try to actually help facilitate the person's ability to heal, which is what vitalism does. We have this reductionist approach that says your symptoms are the bad thing. Your cough, your fever, whatever is the bad thing. When we realize that like the way that we got here is through countless and countless and countless iterations of perfecting this body, right? Are our bodies dumb or are they unbelievably smart? And the thing that drives me crazy is that it's like we never actually give the body supportive things to help it heal. We just try to mitigate symptoms and go about our life. You know what I mean? And these are the conversations that, I didn't get to grow up in your paradigm. So I've had to learn this the hard way, like through watching and through reading. And for example, knowing that if you have a fever, and this came out a few years ago, if you have a fever and you take a fever reducer, you prolong the length of that illness. So by dropping your body's core body temperature, you're now inhibiting your body's own ability to kill off the bacteria, thus letting the germs last there longer. So it's like, what do you want? Do you want to feel better temporarily and be sicker longer? Or do you want to support your body's natural ability to heal? And then when we have these problems and we don't do that, it's like maybe you're still deficient in vitamin C, vitamin D, zinc. Maybe you have interference in your spine. Maybe your body can't heal well. And then we just take more and more things to suppress symptoms without ever getting to that core and supporting our body's ability to heal. And that's just the worst way to live when you think about it. You know what I mean? You're just mitigating symptoms all the way down to the grave.
The intelligence of the human body, the innate intelligence within your body is smarter and more capable than any human person or drug can treat you.
Yeah.
And I think once people really grasp that concept and can understand it, they will have a much, much better idea on what true health is, and how to stay out of your body's way of healing itself.
Yeah.
No one said that being sick was fun, but being sick is good. Just like what you talked about with the temperature. When something has invaded your system is because your body was a perfect, nice 98 degree, wet host for the body. So what the body does is try to make it a not very good host for the body. So we don't want to suppress these problems or suppress these symptoms rather. We want the chiropractic perspective is let it ride out. The body will figure it out on its own. It's been doing it for eternity.
Yep. Beautiful. Beautiful.
I mean, even with this internet machine at our fingertips, whether it's cell phone or your laptop, one quiz question would be, at what temperature do you go to the emergency room? And as a child, I knew the 98.6, okay, this is what, your temperature should be. But I think oftentimes when the parent feels the child's forehead, they're kind of ingrained to just take them in right away. But even just doing a quick search, it's, at about 104 degrees is maybe when you could start to consider.
Yeah.
But anything below that, you just manage it with care and love and hydration.
Yeah. Well, it's incredible that like, what we understand now is that like when research comes out, right, when we learn new things about the body, when we learn new things in literature, unfortunately, that doesn't really reach the light of day for anywhere from 5 to 7 years, and it doesn't actually get put into practice for 20 years. So I've read the exact same thing you're talking about, where they talk about that change, right? But then I'll talk to parents who are like, no, you don't understand. What my doctor told me is this, right? Whatever, whether it's fever, whether it's temperature, whether it's blood pressure, or whatever. What my doctor told me is this. My doctor told me that, my cholesterol is over 200, for example. I therefore have to take a statin medication, right? What came out 5 years ago is, there's a normal variance in cholesterol between 150 and 250, and there's a ton of other blood markers that can actually tell you whether your heart's healthy or not. But again, that literature is now to this day 7 years old. Yeah. Your doctor's not going to be talking about it for 20 years. So when it comes to this world that we're in, like, you've got to attach yourself, have a team around you who has your best interests at heart, who's not worried about, other things that aren't important, who are worried about how to help you stay healthy, not what to give you when you're sick, right? Like that's the wrong question. It leads us down a wrong path in healthcare. So what I love about you guys and what we get to do is we're surrounded by a group of professionals within Max Living, within our network of Chiropractic, within all the different, functional nutrition doctors and people we've brought on board in the last 5, 10, 15 years, that we can now get all this data on answering the question, what builds a healthy person who lives longer in better health? And answering that question versus what do I take when I get sick? You know what I mean?
Right.
So love getting to do this with you guys. It's a lot of fun.
Yeah.
We're going to wrap up for today. Hope you guys enjoyed this video. If you did, hit a thumbs up button, comment below. We want to do more of these for you guys, both whether you're a patient in the office or whether you're someone who wants to learn more about chiropractic care. Let us know how you liked it. Give us some comments, and we'll see you in the next episode. Thanks, you guys. Take care.